Let's start with introducing the speaker.
Okay, wonderful. So welcome everyone to track 8. We're all here to discuss supply chain strengthening for COVID-19 and beyond. My name is Adeza Anelli. I'm a PhD student in the Department of Pharmaceutical Sciences at the University of Michigan, and I'm joined with Yehuda Basok. I would love to welcome both the speakers and all the attendees to this track, and I would also like to introduce them. So we'll be hearing from 3 talks today. The first talk will be for Abstract 9, towards universal health coverage, strengthening healthcare supply chain resilience to mitigate the impact of epidemic outbreaks. For this particular presentation, we will be hearing from Professor Dr. Maria Besiu, who is the Professor of Humanitarian Logistics and the Dean of Research at Kuhn Logistics University, Casper Huing, who is a research analyst and PhD candidate at the Center for Humanitarian Logistics and Regional Development, also at Kuhn Logistics University, Timna Ekschmidt, who's also a research analyst at CORD, and Jonas Stump, who is the Director of Global Programs in Health Logistics. Also in this particular presentation from the World Food Programme, we'll be hearing from Dr. Sylvia Rossi Tafuri, who is the Deputy Head of the Health Supply Chain Strengthening, and Niels van Wassenhoff, who's the Head of Supply Chain Development, West Africa, and Health Supply Chain Strengthening, and then Eels Larkin and Athena Padilla. For Abstract 30, Maximizing Value from Your LMIS Implementation, we'll be hearing a presentation by Mr. David Crew-Brown, who is the General Manager of Italians Corporation, and additional authors are Mr. Pranil Singh, who is the Principal Consultant for Supply Chain Solutions, and Mr. Trevor Lambiotti, who's an Executive for Supply Chain Solutions. Then our final presentation will be on expanding cold chain equipment availability, CCEOP's contribution to stronger supply chains, and we'll be hearing from Sunya Alva and Wendy Prosser from the JSI Research and Training Institute. So, moving into the first presentation. Feel free to begin.
Thank you. So good evening, everyone. Again, it's Sylvia Rossi-Tafuri presenting with Casper this evening from CORD, and sending the apologies of Professor Besiu. So I know that we have quite a tight schedule, so I will go straight into the presentation. So please, if you can move to the agenda. There are a few points that we're going to cover, but especially I will cover in 2 minutes background and motivation for the study. So as mentioned, I co-lead the health supply chain capacity strengthening team within the World Food Programme. And really the team is focusing on public health supply chains and pandemic preparedness. Sorry, I see that Maria is actually here. So welcome, Professor Besiu is here with us. I see her now online. So where is this project coming from? If we can move to the next slide, please. So as saying, the team, my team is really focusing on both public health supply chain and pandemic preparedness. But why is WFP in the space? Very, very quickly, starting from, I think the first Ebola response was really a bit the threshold. Where WFP was called in, and especially the supply chain division was really called in by the international community to contribute to the global response. And this was really replicated for the global COVID-19 response, the most recent one. So the idea really is that, despite our main objective is to contribute, of course, to SDG 2 and 17. Still, we can, as WFP, we can leverage our supply chain management expertise in food assistance to help tackle certain issues that are very similar. So if we can move to the next slide, please. One too many. There you go. So really, there are certain figures that caught our attention in the past. There is one that is a little older from 2018, where for the second main Ebola outbreak in DRC, for instance, where there were 2,000 deaths of Ebola, there were actually 5,000 for measles. So that's where really looking at certain figures, we start thinking, well, how are these two agendas, are they connected? So strengthening public health supply chains and in the broader umbrella of universal health coverage and pandemic response and epidemic response or health crisis response more in general, are those connected? I was reading yesterday actually a very recent figure that was shared and apparently for what concerns malaria and malaria deaths in the last year or so, actually we're back to levels that were those in 2011. So it's a big step back. So the connection really between health outbreaks and the impact on UHC, it is immense, and we have seen it. There's plenty of those figures that could be mentioned. Now, the interesting thing is that literature suggests that supply chain system really sit a bit in between these two agendas and can connect those. So they can act together with other elements that go beyond supply chain system, but they can act as a lever really to play on the two and really to try to reduce the impact of health outbreaks on public health supply chains, but also to increase the resilience of the system to respond to the health crisis. So that's where, not by chance, I have mentioned the concept of resilience, which is really the other, big concept that we refer to. But really, the idea is to look at, okay, if theoretically supply chain systems are really the connection between the two agendas, it is time to understand how. So I will pause here. I will pass the floor to Casper from KLU to get a bit more in how we have really unfolded this. Casper, please, over to you.
Yes, thank you, Sylvia, and thank you for the great introduction. I'm here on behalf of KLU. Maria Bassoons unfortunately doesn't have her voice right now, so I'm presenting KLU today, and I'm very proud to do so in this project team. So here on this slide, we're looking now a bit on the implementation, on how we're doing that, what Sylvia already introduced to us. First, we want to cover on what are actually the dynamics that happen during a disease outbreak. And what we see here right now is a very simplistic example public health supply chain, right? In dark blue, we have some form of suppliers. We may have country entry points if these are international suppliers like airports, seaports. In light green, we have the core of the in-country public healthcare supply chain with central warehouses, regional district warehouses, and service delivery points. So in this case, we have a 4-tier supply chain. And then we have patient treatment at the service delivery points by healthcare workers. Now, if we click for the animation, there's a tiny bit of animation coming. So we have, if there's an epidemic striking, on the one hand, what happens is that this creates needs. Patients require healthcare services if they are infected by the epidemic disease, and simultaneously healthcare workers may be affected and decrease the capacity actually of treating patients. Now, on the left side, if we move the animation, What we also have is that that the needs for a medication, PPE, and all the goods that we need for the response increase. So what we have is there's more patients, there's more medication, more of everything. So the supply chain somehow needs to handle that. And this is where many bottlenecks, this is the next animation. One more, we add one more immediately. So this is where many bottlenecks in the supply chain can actually arise. So for example, at the point of entry, where air or seaports might not handle the cargo, or simply because warehousing space is not sufficient or transportation space might not suffice. So we might experience bottlenecks all over this supply chain. This puts me to the problem statement on the next slide. We aim to understand these public healthcare supply chains better and understand where specifically are they vulnerable to this epidemic outbreaks. We want to analyze, or we're analyzing the bottlenecks and the capacity constraints of the systems. And as Silvia already mentioned, the resilience of the public healthcare supply chain to epidemic outbreaks. And resilience here is always a concept who refers to maintaining PHC operation, primary healthcare operations, while also responding to the epidemic and trying or balancing these two in a good way. And with that, we can identify leverage points for preparedness investment. So investigate preparedness investment that are typically looked at in this light of epidemics or disasters in general. But we want to understand what are the leverage points for preparedness, what are the effects of preparedness also for the provision of primary healthcare during epidemics. Okay, and with these two elements, preparedness and resilience are then essential for healthcare system strengthening and reaching universal health coverage. Moving on, we use system dynamics to do that, and that's Sturman phrases this as a perspective and set of conceptual tools that enables us to understand the structure and dynamics of complex systems. So we use this methodology because public healthcare supply chains are very complex systems. Actually, we have many tiers, we have many interactions going on, many dynamics. And this methodology allows us to evaluate the resilience of the public healthcare supply chain, which we discussed already. It allows us to assess the impact that epidemics, outbreaks have on the public healthcare supply chain, on public healthcare provision as well. And it allows us to simulate different scenarios. What would be the effects of different preparedness activities, for example? And we will combine that in the next phase also with case studies, which means that we are aiming to implement the model in target countries. Next, please.
There are 5 minutes remaining also.
Thank you. So a quick look behind the scenes. We are seeing again a depiction of the public healthcare supply chain. And now the interesting part here is that we are splitting between the relief item supply chain on top and the primary healthcare supply chain on bottom. So in red, the relief item supply chain, and blue, the primary healthcare supply chain. They're using the same capacities, but they both need to go through the same supply chain. And what in our model, we are differentiating 3 parts. This is the supply chain, the healthcare service delivery, and SEER, so conceptually. But all these are also interlinked again with different mechanisms. And if we click once more, we have, these are the aspects of the supply chain part of the model. So quite surely all the capacity, all the transport and storage parts, and also forecasting and ordering. Then we have healthcare service delivery points on the right. If we click once more, and we have the SEER model, which is the next click. So the SEER model simulates the epidemic and therefore creates the needs for relief items in the supply chain. Yes. Thanks. So this is a depiction then of the system dynamics implementation, and due to the restrictions of time, I won't go into detail, here, but this is one part of the model. This is a SEER model. And maybe just to show on the right-hand side of the graph a tiny bit, what we see is around the day, the epidemic starts actually at day 100 and around 258. This is the peak of the epidemic when most of the suspectable population moves towards the immune population after being infected. Okay, next, please. So once more, sorry, this is, yes, now we're moving to preliminary results. And this said, as this is not implemented yet, the data, for example, on capacities is not fabricated yet, so to say. We have the simulation time on the x-axis from day 0 to 500 for all the graphs that I'm about to show now. And the first graph, the logistics shortfalls, shows that if it's below 0, there's a logistics shortfall. And in major logistics capacities that we're showing here, there is a severe logistics shortfall during the epidemic. So between day 150 and 300 in the peak of the epidemic, there's major logistics shortfalls. And on the right-hand side, actually, we see what that means for service delivery. So here we're looking at the number of people that came to a service facility, wanted to get treatment, but couldn't get treatment because of these logistics shortfalls. And we are seeing that right around the infection of the infection peak, there was very many people that could not get treated. Okay, next slide, please. Then we also look at different preparedness measures, and this is just a small example. On the left, we look at extra logistics capacity, and so in green, the base scenario, and then two additional, the yellow, for example, is an additional 100% of logistics capacity. And what we see is in that scenario, the peak performance, so at the peak of the infection, the peak performance of the system can actually be increased by additional logistics capacities during the epidemic. And if we look on the right-hand side, we're looking on prepositioning instead. And here we do not see an increase in the peak performance, but we see a slight performance increase in the beginning when more people can be treated in the yellow scenario at the beginning, around between day 150 and day 220. Maybe, but it seems like a smaller effect here. Okay. Let me move to the last slide to wrap this up. We're looking at public healthcare supply chains and their resilience to disease outbreaks. And we believe that this supports informed decision-making regarding preparedness investment, and actually then increases also the resilience of these public healthcare supply chains. We use Sysmedynamics modeling, and we will implement this in multiple case study countries in the following year. Preliminary, we find that public healthcare supply chains are overwhelmed with epidemic demand shocks, and that investments in preparedness are good countermeasures, actually, that do not only counter the effects of the epidemic, but also PHC supply. This is yet foundational research, so any confirmation using quantitative empirical testing in the subsequent years is very welcome. And also to extend the model and what we're doing to use further linkages between universal health coverage and epidemic outbreaks. So moving to the thank you slide, and I want to thank you for listening, for participating, and we're open for questions and feedback. And I'm not sure if we're having a question round now or if you're first listening to all the presentations.
We have a couple more minutes for questions, unfortunately, due to the time that we started. It was a little shorter.
Okay, thank you. Are there any questions?
Yes, I have a question that I would like to ask you. So I didn't understand, what are the actions that you are proposing? For example, should we build extra capacity, or should we build inventory of, let's say, PPE, mask, or medicine, or whatever, so that when the epidemic happens, we have them on place and we are ready?
This is a very, very good question. At this point of the study, we are not able to answer this in generality, I would say, and maybe we will never be, because this is case specific. But what our model and what our research allows is to assess exactly this question for the case that we are looking then in particular. Okay, so this is very case dependent, I would say.
I got it.
But our model allows to answer that question then, depending on the case.
Yeah, thank you.
Thank you.
Thank you very much. We will have to move on to the next presentation. Thank you so much for your presentation.
Thank you.
Okay, now we would like to hear from Mr. David Crew Brown, who is the General Manager of Italians Corporation.
Hi, good morning, good afternoon, good evening to all our colleagues. Thank you for the warm welcome, and it's just a pleasure to be with you all today. Really appreciate the opportunity to share with you a little bit of our story from VitalLines and just the work that we've been doing specifically in the OpenLMA space. My background, I've been in FMCG for 20 odd years in supply chain and been in the pharmaceutical supply chain over the last 5 years, working together with the South African Department of Health, and now more recently with VitalLines. So really with the aim of improving healthcare across Africa, and it's been a pleasure to be in that journey and see how we can make improvements. If we can start the presentation. So today I'll be taking you through, you would have seen from the outline there that we'll just be going through OpenLMA for those who may be not so familiar with what it is. Try and give you a bit of a background about OpenLMA, a bit about VitalLines, and then we're going to be going into the topic for tonight about maximizing the value output from OpenLMA. Thank you. Sorry, I'm just making sure we're on the right slide. If we can, yeah, perfect. So in terms of the OpenLMA footprint, VitalLines was really born out of 2 organizations. The one is One Network, which is a software systems organization that really provides technology, control tower type technology, end-to-end capability, and Imperial Logistics, which, Imperial, I think, may be familiar to some on the call, who do a lot of logistics, transportation, warehousing, storage, and kind of freight forwarding type operations. And then between the 2 of those, VitalLines was born, and really with a focus of driving a service support, supply chain services in the pharmaceutical healthcare space across Africa and further afield. Out of that, we then received the opportunity to become the stewards of OpenLMA, which happened about a year and a bit ago, and we started this journey of supporting and walking alongside OpenLMA. As you can see, OpenLMA, just from a system, has kind of grown over the last few years. It's implemented throughout, it's about 12 countries, so that map has 1 or 2 countries that we can update it on. And
It appears we may have lost you, David.
Yeah, we have lost David. David, can you hear us?
I think he might just rejoin the meeting.
Yeah, let him rejoin us. Let's wait for a minute, and if not, we will go to the next presentation. So I suggest we go for the next presentation.
Okay.
And if David comes back, he will present later.
Okay. So for this presentation, we'll be hearing from Soumya Alva and Wendy Prosser. They've pre-recorded their presentation, so we will watch the video and then there will be time for a question and answer.
Hi, my name is Soumya Alva from JSI. I will be presenting today with my colleague Wendy Prosser, also from JSI, the results of the evaluation we conducted recently for Gavi on the CCOP, the Cold Chain Equipment Optimization Platform. Today we'll be presenting our findings in this presentation titled Expanding Cold Chain Equipment Availability, CCOP's Contribution to Stronger Supply Chains. To quickly go through the presentation, we'll be focusing on the background and evaluation approach, the endline evaluation findings, the lessons learned, and finally a conclusion. So a little bit of background on CCOP. CCOP was established by Gavi in 2015 and launched and approved in 2016. It covered a range of countries, 55 countries, with 2 additional countries that were added later in 2019. It had 2 main objectives. One was a country level goal, focusing on providing functional cold chain equipment to countries and strengthening the vaccine supply chain with the objective of immunization equity and coverage. This was a new model that was introduced with service bundle providers who worked with manufacturers to deploy equipment in countries involving inland distribution, installation, and user training, etc., taking care of issues when there were repairs needed under warranty. The other component was the global market shaping component, which focused on incentivizing a market to make sure that CCOP was available at a reasonable price to countries, and to make sure that there was enough of a market for high-performing equipment and services to be available for countries. We are not going to be addressing the components of the market shaping in this presentation. We will be focusing on the country-level evaluation alone. The country-level evaluation that we conducted was in 3 countries between 2018 and 2021. Specifically, this was Kenya, Pakistan, and Guinea, involving a series of data collection efforts. The main objectives were fitting with the OECD DAC criteria, focusing on the relevance of CCOP support, also with additional focus on looking at the joint investment between countries and Gavi, all aspects of the service bundle provider services, and the option of delinking the service bundle provider component from the provision of equipment. We also focused on looking at the comparative efficiency of the cold chain equipment over time, the extent of the effect of cold chain on immunization outcomes and other results. There was a strong focus on sustainability in the long run, the effect on the immunization program in general. And as a result of the evaluation, we identified lessons learned, also identified challenges and how they could be overcome, and provided recommendations to various stakeholders. In terms of methodology, as I mentioned earlier, we had multiple data collection time points between 2018 and 2021. This was a prospective mixed methods research with data coming in from multiple sources. First, through document reviews, which was deployment plans, monitoring data, notes from the project management team, meetings, etc. We conducted key informant interviews at multiple levels of the health system, right from the national level all the way to the facility level. In addition, there was a short health facility assessment that was conducted on a small sample in each country to provide us a snapshot of changes that took place as a result of CCOP development. To the extent possible, we also used HMIS and LMIS data. However, because of data quality and other issues, it was not possible for us to use it to the extent that we'd have liked. Other analyses that we conducted were based on CC capacity and temperature monitoring. One thing to note is that although we tried to have a clear program control design, it was not feasible given the nature of the deployment of CCOP in the different countries. So the health facility assessment primarily provided a snapshot of the deployment process and the snapshot of how health facilities benefited from CCOP. Going to the findings of the evaluation, these have been organized under 3 broad areas. The first was process improvements, to see if there were any improvements in the process through which CCOP was deployed in countries and the perspectives of different stakeholders regarding the process. The second was looking at any impact on immunization services in the country and changes in the supply chain. And the third aspect was focusing on sustainability and overall needs of the health system as a whole and the supply chain system. The findings were a mix of positive and negative findings, and in some instances, as we will explain later, the findings were mixed as well. I'm going to pass it on to my colleague Wendy to get into more detail into these findings.
Thank you, Soumya. I'll go through some more of the details, as Soumya mentioned, of the findings. First, with the process improvements is the contribution to the growth of national level planning and management structures and systems. And what we found there with the project management teams, which was a requirement from Gavi to set up, is that there were very clear procedures for the proposal development. They put together these operational deployment plans that were very accurate. There was good coordination with the service bundle providers who are doing the installation of the equipment. There was a good process for monitoring the installation and tracking the documentation of it. And there was good tracking of CC performance post-installation. And this was one of the benefits and one of the positive results of the CCOP is creating these processes and procedures for the Ministry of Health and the project management team to take ownership of that. There was noted some communication gaps between the levels of the health system across all 3 countries, which is not unique to CCOP or to supply chain, as we all know. A second key finding was kind of a mixed finding with the service bundle providers. And as Soumya mentioned, this is a great innovation that CCOP came up with and designed. And for the installation, there was positive feedback on the installation done by the SBPs. Stakeholders are very satisfied with it, satisfied with the services. After installation, however, there was some concern about the ongoing services that the SBPs provided. There was also some concern of the cost of the SBPs in taking over what the ministry felt they could be responsible to do in terms of installation and ongoing maintenance. There was a consistent request from stakeholders on additional training. The training that the SBPs provided was seen as not sufficient enough. And again, the communication gaps between the levels. Good communication between Ministry of Health and at the national level and the SBPs, but at the lower levels, the horizontal communication could have been improved. In the area of impact on service and supply chain, they found that they successfully and substantially increased availability and capacity of the cold chain system. And we're going to get into the details of these over the next 3 slides. And so with the availability, you'll see from baseline to inline, the large majority of facilities had equipment at inline. A particular notable finding was in Guinea, and Guinea had prioritized health posts for CCOP equipment because health posts previously had no equipment at all, and they would go fetch vaccines daily or weekly to provide immunization services. And so you can see in Guinea and the health post, there was a huge increase in the number of facilities that actually got equipment. And also across Kenya and Pakistan, all of the equipment had been installed and all the facilities then had this more optimal equipment available to them. We looked at the cold chain capacity. So looking at just the regular EPI schedule and the monthly delivery as standard delivery frequency, and looked at the capacity utilization of that. We identified the categories of appropriate utilization between 10 and 80% of the space, underutilization using only less than 10% of the space, and constrained utilization defined as more than 80% of your space being used in that regular EPI schedule. You'll see between baseline and inline, the majority of facilities now fall in the appropriate utilization and underutilization. And the other great finding from this is the non-PQS functioning CCE in the red, that also reduced. So this new equipment came and replaced this equipment, the non-PQS equipment that shouldn't be used. It's not recommended to be used for vaccines. So this was another finding in terms of just the amount of equipment and optimal and more reliable equipment that is now available. Finally, the CCA functionality also was improved, and just the reports of functioning at the end line are not. And then we looked at the temperature and the temperature range, and the large majority of the equipment at inline was in that ideal temperature range of 2 to 8 degrees. Finally, we looked at immunization services, and there was an increase in services and the frequency of immunization services that were provided. And again, especially in Guinea, where now equipment was in the facility and they did not have to go fetch on a weekly basis, we saw a great increase in the frequency of immunization services provided. Then the other main area that we looked at is the system support and the overall system. And there was some negative results or some things that the gaps in the overall system performance. And one is the maintenance system. And this was a consistent concern from stakeholders on maintenance and how cold chain equipment will be maintained beyond the warranty, and also not just with the CCOP procured equipment, but with the thousands of other pieces of equipment that are already existing in the system. The current CCOP equipment works really well. That's great. And it's under warranty, and the SPPs are still providing, responding to maintenance issues that are covered under warranty. However, it's within an overall system that has very weak maintenance systems already, and multiple brands of CCE has negatively affected the knowledge of the warranty and corrective maintenance and preventive maintenance practices. And that was just one gap that we saw, that these maintenance systems have not improved, although the most immediate need for the CCOP equipment is minimal maintenance needs at this point. But thinking longer term, how does a Ministry of Health strengthen their overall maintenance system to ensure that this investment in this new equipment continues for years to come? And finally, we wanted to show the stockouts. Essentially, the stockouts didn't change. There were stockouts at baseline, there were stockouts at inline, and it was not consistent any reason. I think one expectation was that with new equipment, you would then have stock. But I think, as we all know, it's much more than just having cold chain equipment. It's all the other factors that influence stock availability. So I wanted to put this in here just to show that even though the equipment is there, the other factors that influence the supply chain management still need to be addressed to ensure the vaccines are available. So a few of the key lessons learned that we found from this is the accurate CCE inventories, and this is necessary for planning for the most immediate plan and then also long-term planning for equipment. It is a high level of effort to get an accurate CCE inventory, and one of the challenges I think as a global community now is thinking about how we can create systems to have these inventories updated on a regular and easily accessible way. The operational deployment plans, ODPs, this was something that CCOP created as a requirement for planning out the installation. And they were largely accurate. And another great finding from this is that the SPPs were quite flexible with the minor deviances from the ODP. And if they got to a facility and the facility didn't have electricity after all, and they could adjust to where the equipment was going to be installed. And so the ODP was a really great practice of thinking through the planning requirements for this large scale deployment of equipment. Maintenance systems, as I already mentioned, we need to really rethink maintenance systems and how to strengthen those to guarantee the longevity of the equipment itself, as well as the non-CCOP equipment. Communication about warranty, we mentioned this a bit. It was really not clear for country level stakeholders what was included in the warranty and what was not included in the warranty, and how the SPPs can be used to resolve any maintenance issues. So one of the recommendations is more clarity on the warranty itself and more involvement with the ministry when they're actually contracting with the SPPs. The systems perspective, I keep bringing this up because it is such an important thing. And there's now a lot of new cold chain equipment that's optimal and reliable and efficient. But it takes much more, as we all know, to get vaccines to a person and into the arm of babies. And the whole systems perspective is now where we kind of need to shift attention and focus to make sure the cold chain equipment continues to function well, and also the vaccines are in trucks and are moving through and the data is coming in, and everyone has the necessary resources to ensure vaccines are available and administered. And then the last thing that we wanted to touch on is this adaptation of procedures. That CCOP created many of these adaptations of procedures, these processes and these reports and tracking SPP installation processes and the PMT. And all of these are best practices that could be used in any kind of system, in any immunization system, and further supply chain planning with or without a CCOP, right? These are some great best practices and processes that have strengthened the leadership, have strengthened management processes, and I'd love to see that continue. So just the final conclusions, what we have is that CCOP has been very successful. It's gotten deployed thousands of pieces of optimal CC into country supply chains. It's creating strong processes for continued management, and it has expanded immunization services. A unique part of it is using innovative private sector approaches with the SPPs to create a more reliable supply chain. With the evaluation, we also saw gaps in the overall supply chain system. The maintenance systems need some attention. The vaccine management best practices need to consistently be reinforced and adopted into regular workflows. And then more attention to strengthening the overall system will greatly contribute to a stronger supply chain in the future. Thank you for your time. I think we are both now available for questions. Thank you.
Thank you for that lovely presentation. We'll now move over to the Q&A section for 5 minutes.
It was so riveting, there are no questions. One, I'll just jump in. Because this track is on COVID, we looked at this from just the regular EPI schedule process, and it was before the COVID, everything happened with COVID. But always the one main question with COVID is the space in the cold chain. And some of the capacity utilization analysis we looked at did show that at the facility level, there is space for growth and more space than people tend to think. At the facility level with the COVID vaccine, it's right now the focus is on campaigns, somewhat getting down to the facility level. But all indication is that to the facility level, there is growth and opportunities for more vaccines, for also shifting delivery frequencies, thinking about a more efficient way to manage your cold chain, because there is space to consider that. And so one thing I wanted to add to that.
Any comments, any questions? So thank you, and we'll move today, David Beck. Thank you for a beautiful presentation and clear.
Yes, thank you very much. All right. David, can you see the screen now?
Yes, can see it. Good evening again, my time. Good morning, other parts of the world. So yeah, apologies. Had a power dip at home for some reason and lost my internet. So sincere apologies, and I'm glad to be back with you all and to have enjoyed that previous presentation. Just to pick up where we were left off, I was briefly talking about OpenLMIS and how it has grown over the last few years. You can see really implementations across several countries in Africa, up to 12 countries where OpenLMIS is being used at the moment, and also quite a growth in terms of number of users, over 12,000 users that are using OpenLMIS at the moment. And maybe just to briefly share, OpenLMIS at the heart is a inventory stock management system that looks at how you can manage your stock at a facility level, and with all the correct process and workflows through to generating an order, getting it signed off, getting it picked, packed, shipped, and then receiving that order back at the facility. So that's the essence of OpenLMIS. If we can go to the next slide, you'll see that I'm trying to position here where OpenLMIS plays within the space. And you'll see that there's tactical planning, which of course is our sort of long-term planning where you're trying to do the balancing of your demand and supply. There's the operational planning, which is looking at your different components, you know, how you're going to get the stock, what are the materials required in that environment, how do you actually move that stock? And then the executional phase where you actually are physically planning the movement of the stock, you holding the inventory, you are generating the stock availability for the specific facilities. If we can click through, you'll see that OpenLMIS plays sort of in that bottom space. And you'll see that there's inventory management, there's requisition management, there's data management. Of course, master data, as we all know, is always a challenging environment. I see some of my colleagues from my previous role on the call and on the conference, and master data was always a challenge. And so that's all managed within OpenLMIS. But there's also a component, if we do a last click on that one, that you'll see in the medium-term planning, when you start looking at your replenishment planning on a slightly more holistic basis rather than just at the unique facility. So if we look across at the next slide, let's talk a little bit about what OpenLMIS brings to the party. First off is the requisitions, and this is really to move, if you think about facilities across the environment where we play, often are still very paper-based, manual reporting, all the challenges that go with that, no data visibility, there's no capability in terms of seeing that data on an aggregated level. And so OpenLMIS creates that opportunity for you to start generating orders, managing your stock and your inventory at a facility using a system. First part is requisitions, where you can then generate the orders, and part of OpenLMIS, as you start using the full functionality, it starts generating a recommended order that you can then review and approve against your settings. There's also the order fulfillment. In the order fulfillment space, we are looking here at fulfilling the orders that have been placed. And that's the whole workflow with signing off, reviewing if the stock is available, accepting the order, fulfilling the order with the pick pack, and then actually shipping the order. There's the whole space of managing your inventory, which we know is also crucial. And some of the colleagues have mentioned that on the call, on the conference just prior to my opportunity to talk. And that's really where you're wanting to start optimize your stock holding. You know, do you start ordering on a more frequent basis? OpenLMA also provides the opportunity to create that analytics and reporting level, so you can see the data, again, you know, from a place of it being on paper to being electronically available so that everyone can see it. There's the opportunity to use handheld technology, which is sort of a new development for us, and I'll speak a bit more about that. And then starting to look at how do you start adding functionality. And recent functionality, again, that we've added is being able to monitor your cold chain equipment, which, again, in the space that we're playing with COVID implementations, something that you really need on a very important frequent basis to be able to monitor what your cold chain, how your cold chain is operating. So that gives you a bit of a sense of the features of OpenLMA. If we look across the next slide towards the principles, how does OpenLMA work? So really it is an open source solution. And that means that it's this whole concept of everyone is contributing. It's shared investment, so everyone who invests behind it will benefit, of course, because of the investment, but that investment is made for the broader community. And I think that's for us been the exciting part, is seeing the community get involved. Of course, every environment, every country, every organization that we work with have specific needs and requirements. And so in that space, the idea is that as the OpenLMA system gets developed out, we can then start sharing that functionality to a broader community. What it does mean, though, is that we need the role of stewards to make sure that that investment and kind of development is done in a way that actually can be added back to what we call the core product. And that's the role that we're playing as stewards, to make sure that all investments that are made, all development that's added, is of such a nature that it can be added back. The second component here in terms of OpenLMA, the sort of heart of OpenLMA, is also to be able to operate between different systems. So we've made sure that it's built and it's been developed over many years, that it can link to many other systems. And that interoperability gives us the opportunity, like the cold chain equipment, to link in with other systems that actually do some of that cold chain equipment monitoring, and you can get the benefit of sharing data in terms of stock on hand within an environment where you want to potentially monitor that stock for potentially cold chain or for other purposes. And then the last component that we've looked at is to say that OpenLMA is configurable and you can extend it. And that really means that you can start with a small program. You can look at a vaccine program per se and say, let's get all vaccine medicines managed on OpenLMA. But then over time, you can scale it and start adding other programs onto OpenLMA and actually start scaling it across the country. If you've just focused on a specific area, you can then build it out. And I think that capability to almost start small is something that I'm going to be talking a bit more about in some of the slides to come. So if we look at the next slide around COVID per se, it was really for us the opportunity to do what we call a rapid deployment in getting OpenLMA set up in a way that you can very quickly start using it. Of course, we know that in this space, you can't wait 2 years for implementation, because by then the challenge that we're experiencing now in the healthcare environment is potentially going to be, you would have missed that boat, so to say. So it was really around how do we get a very quick configuration, and that was what we called then the rapid deployment of OpenLMIS. It focused on specific features such as stock management, ordering, some of the dashboards and delivery. And really the other focus was about how do we get the teams in the country up to speed very quickly on managing the inventory for COVID using the system so that we can actually know if we've got the right stock where it's meant to be and that we're holding the right level of inventory. This has really helped us 3 countries where we've implemented: Nigeria, Cameroon, and Eswatini. We've recently done this COVID or rapid deployment of OpenLMIS for specifically COVID. And that has really helped those countries in their management of the COVID vaccine program. Then just talking about, thank you, the flexibility opportunity. You know, if we talk about start simply, you can start in an environment where instead of the order gets fulfilled on a demand forecast, you're actually pushing the vaccines out and able to at least track them. And you can see what is the consumption, what is the stock on hand. You can start getting some visibility. If we then click through, you'll see that as you start journeying, you'll see that there's advanced features. And that could be what we've said earlier, cold chain equipment, could be some other integration with other systems. And then finally, that gives you the opportunity to grow into that sort of routine resupply where OpenLMIS becomes the tool that you use for replenishment planning at that facility level. You can start looking at what the demand is, get a better sense of what the demand is over a period of time. You can look at the ordering and approval process, which might not have been implemented at the start. You can start generating some information gathering around indicators that you want to track, and you can get to auto-calculating resupply quantities where the facility, if they're capturing their stock on a regular basis, are able to then get a recommended order that then comes through. So if we look through to the next slide,
David,
as I mentioned,
we have 5 more minutes remaining.
5 minutes, that's great. So just a few touches. So mobile application includes some of the functionalities. And as we know with all systems, mobile capability is great because you can get some people at facilities to start using the technology that's in their hand rather than having to get computers in place. If we can move to the next slide. The second thing that was recently released around OpenLMIS with our 3.12 release was actually this end-to-end integration. And really the thought here is that you start integrating with systems like One Network, which is an end-to-end supply chain system. You can then start providing data from OpenLMS into that bigger supply chain system, and then the orchestration of the supply chain can happen in that typical control tower environment. So I want to draw to a close now with the next few slides. This slide just then talks to those benefits. So if you are linking into systems like One Network or other end-to-end supply chain systems, you can start getting to those higher end supply chain enhancements around demand forecasting, your inventory optimization, replenishment planning, and last mile type allocation. So those are all opportunities for you to go from, I suppose, quite a basic supply chain planning environment, which typically you would think around your inventory planning, to more advanced supply chain planning and some of those that I've called out there. Then I think the last slide for tonight is really then around having that end-to-end visibility. And this is a bit of a network position, as you would know if you have kind of studied supply chain, have gone through the SCORE modeling. You know, your supply chain kind of goes broader and broader, and you need to eventually know, you know, within your supply chain there's a procurement, manufacture, a supply, a return, and then the planning that goes across all of it. But that links into a customer, and that links into a supplier. And in this environment, really where we want to see the end state is as you start linking systems like OpenLMIS into other systems, you start creating that capability to see across the entire chain. And maybe if we can click through the first click here, you'll see that you might have a fire that breaks out at one of the tier 2 suppliers that you're not even aware of. That tier 2 supplier is going to impact the entire chain and will result in medicine unavailability. If you have visibility, you are able to, sorry, I think the click through, never mind, but I think if you can have that visibility, you can then see what is the impact going to be of this out of stock. Are there other suppliers who can supply the shortfall? What does the inventory level look like at the supplier? Can we increase the production to use up all the stock on hand beyond what they were planning to use? And in that way, you can alleviate a stock out at the clinic and the hospital all the way down the line. Similarly, if you have an issue at the DC, you could have potentially identified this is a problem and it's going to impact the hospital and clinic, but there's stock in the entire system and we can reorganize and we can start sharing some of that stock around in the system. So really, I think the message for tonight is that there are, our journey with OpenLMA has been one to see several countries move from paper-based systems to automated systems where you can actually use technology to help with that whole inventory planning, making sure you have the right product at the right place at the right time. But as we mature and start integrating, start adding functionality, we can actually get to a place where you can start orchestrating your supply chain and you can get better visibility that will lead to better product availability at our customers, at the clinics and hospitals, and what we believe is better healthcare across the whole chain. So I think the last slide, if you click through, is just a slide to say thank you very much. We do have the OpenLMA community. I wanted to just put it out there that if there's anybody who would like to join the community, you are more than welcome to do so. We have a website where you can go or you can email us. And really, I think as with all our colleagues who've been on the on this section of the conference, we are all trying to improve healthcare for all, and really are very keen to join to grow this community and see many of you join us. So thank you very much for your time tonight.
Thank you, David.
I'm happy to take questions.
Thank you, David. I have a question. You didn't speak about the user participation. What is happening with the user? Do they participate? Do they key in the data? What is happening there? What is your experience?
Yeah, so thank you for that question. The user actually interfaces directly with the system. So it is facility-based, where the user would be looking at their stock on hand, capturing their current stock, the stock that they have on the system. The user would then be reviewing once they've managed to do a stock take, so to say, or kind of capturing their stock on hand. They would then review the order that either is generated as a recommended order, or they can generate the order themselves with overrides. And the order will then from there be go through with a workflow for approval, and then finally get sent through to the warehouse for that pick, pack, and ship. And then the user, once the stock has arrived, will then capture that stock back into the system to say that they've received the stock and their inventory has increased. So definitely user-based, as I mentioned. We have a mobile component of this now. Before it was all computer-based. And so the user would physically key in stock on hand with reasons of how the stock has been used, whether it's been it's expired, or whether it's actually just been consumed, or whether there's been any damage to the stock. So there's a whole lot of reasons for it, but the user actually is directly interfacing with the system.
And they are using it.
Across 11, 12 countries now. We've just recently had the Gambia also start the process of implementing OpenLMA, and around 12,000 users that are using it on a daily, weekly, some less regular basis, but for many of them on a very regular basis.
Thank you. Any more questions? So I have another question. I'm just curious. You said that
Yes.
you can add, for example, inventory optimization. Can you say a few words about what you are doing?
Yeah, so I think twofold. One, in terms of inventory optimization, the current OpenLMA tool, the optimization part it will do is to recommend the order against the rule set that you've established, and it can then start tracking usage over a period of time to see what is my actual usage and what would my need be given the lead times and the batch sizes and quantities, and then it will generate an order, which is, I suppose, for me, the first part of inventory optimization, because at least you are making sure that the correct order is being placed. I think the second part is as you start integrating with further end-to-end supply chain systems, like in our case, we've just completed an integration with One Network, then you can start leveraging high-end inventory optimization capabilities. And so you can start planning to fulfill against the demand forecast. You can start planning to look at the process of sharing stock in a low stock environment, making sure that all facilities are holding the same, what we would call it, days of cover or weeks of cover. And that can all be done with those higher-end systems. So those would be examples of inventory optimization.
Thank you.
Great, thank you so much.
Any other questions? So we will stop here, and I'll encourage you to go to the networking session. And thank you, David, again, and thank all of you.
Thank you all.
Great pleasure. Thank you, everybody. Enjoy the rest of the conference.
Thank you. Bye-bye.